So members, the first item on our agenda is House File 663. I'll be laying House File 663 over for possible inclusion in the Human Services Finance Bill. Representative Lippert, welcome to the committee. Looks like you have two amendments on your bill. The first one is the A1 amendment. Would you like to move that amendment?
I would like the committee to take up the amendment, yes.
Okay, I will move the A1 amendment. Sorry, you're not on my committee. I will move the A1 amendment to House File 661 or 663, sorry. Do you want to describe the amendment?
Yes, Madam Chair. Very simply, the A1 amendment has a few technical changes, and then make sure that the integrity initiatives in Article 1 carry over after the CSS transition.
Okay, any questions from members for the A1 amendment? Okay, all those in favor of adopting the A1 amendment, please say aye.
Aye.
Aye. Any opposed? Okay, the motion prevails. And Representative Lippert, looks like you have an A2 amendment. I'll move the A2 amendment. Would you like to tell us about the A2?
Yes, thank you, Madam Chair. This amendment fills in the component values of the rate framework. It adds cost reporting language and adds a study of direct care workers who use public assistance programs. And Christy Grom or Elise Bailey can speak to it if needed.
Okay, are there any questions on the A2 for the author or for DHS? Representative Albright.
Madam Chair, Representative Lippert, I note that you are making a distinction between the rate methodologies between CFSS and PCA. I'm wondering if you could articulate the differences.
Representative Lippert.
Thank you, Madam Chair. Thank you, Representative Albright. And I will ask Christy Grom if she would, I think she'd be able to more clearly articulate those differences.
Ms. Grom, sure. Ms. Grom, welcome to the committee.
Madam Chair, members, for the record, my name is Christy Grom. I'm with the Department of Human Services. The Personal Care Assistance Program, as it is, will be transitioning to a new version of that program called Community First Services and Supports. And that will begin to occur this fall, I believe, in the fall of 2021. There are a lot of similarities across both of those programs. There's a few differences. The CFSS program offers more self-directed options. It also allows for reimbursement for parents of minors and spouses to provide PCA or those services to people. And there's a variety of other kind of differences that we can, I can bring back to you to get more detail. Otherwise, we have Ms. Natasha Mers, I believe, on the Zoom as well, and she can answer additional questions on the differences between those programs. In terms of the rates are the same. They will transition to the same rate, no matter what it is.
Thank you, Ms. Grom. Representative Albright.
Thank you, Madam Chair. And to the testifier, I also note that there are a lot of moving dates for when these indexes will be updated. And it seems to me, and this is getting into the weeds, but why are they or are they not being updated concurrently, or are they being changed alternately? It seems like we've got kind of a one and then the other and then back to the other type of a scenario playing out here, if I'm reading it correctly.
Ms. Grom.
Madam Chair, Representative Albright, I think I will maybe turn it over to my colleague, Ms. Elise Bailey, to walk through some of those changes in the amendment. They are fairly technical, so I think she could better speak to those than I can.
Ms. Bailey.
Chair Schultz and Representative Albright and members of the committee, my name is Elise Bailey. I'm the Fiscal Policy Director for the department. The change that you're referencing in this amendment will change the inflationary updates to align with the inflationary updates that we do for other home and community-based services that the department provides or administers under the disability waiver rate system. Previous versions of this bill had the inflationary updates at a different schedule, and this would enable it to coincide with that.
Thank you, Ms. Bailey. Representative Albright.
Thank you. It's a fairly substantial amendment. I just have one final question, and whether Representative Lippert wants to answer it or if his testifiers, but I noticed that there's a provision that directs DHS to study the workers and whether they are utilizing other public programs, given, our understanding about MA or MFIP. I'm just wondering what inclusion that will have in your consideration of reporting back to the legislature. What do you intend, what hope is there for that study? What do you hope to arrive at or achieve?
Representative Lippert.
Thank you, Madam Chair, Representative Albright. So I'll just offer quickly and then Ms. Grom can respond too. So the intent, as I understand it, is just to study the extent to which there's that low pay for PCA services is leading to those workers accessing other DHS services, just to try to provide clarity for the legislature on that reality. But I'll ask Ms. Grom to respond to.
Ms. Grom, do you have anything to add to that?
Madam Chair, Representative Lippert handled the question. While I think we have some preliminary data that indicates that direct support professionals are utilizing Minnesota healthcare programs, and we want to make sure we're understanding that aspect and understand if they're utilizing our economic assistance programs, and maybe just to understand better how that plays into their wages and the rates that we provide.
Thank you, Ms.
And
Grom.
We'd definitely be happy to provide information to the CU following that study.
Thank you, Ms. Grom. Representative Albright.
Thank you, Madam Chair. That would be good information, I think, as follow-up from the agency.
It will be interesting to see that report if this bill passes. So let's see. So I'm going to renew my motion to move the A2 amendment for House File 663. All those in favor of the A2 amendment, please say aye.
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 Any opposed? Okay, the motion prevails and 663 is now amended with the A2. Okay, Representative Lippert, to your underlying bill as amended.
Thank you, Madam Chair and committee members. For Minnesota to be a state that works for everyone, we need to ensure that people with disabilities and older adults can access the care that they need. This is a matter of human dignity, and sometimes it's a matter of life and death. There are 44,000 Minnesotans with disabilities and older adults who access PCA services. There are 55,000 Minnesotans who work as PCAs. Of these care providers, 82% are women and 62% are people of color. According to a 2020 legislative report, though, the average PCA makes $12.38 per hour, and this results in high turnover, reducing the quality of care, and creating instability in the lives of people with disabilities and older adults too. There are PCAs who work multiple jobs and still are living at the edge of poverty. To stabilize this workforce, we're going to need a rate framework that provides a living wage for PCAs moving forward, and that's what this bill does. This bill has two parts. First is the rate framework. This legislation establishes a cost-based, data-driven rate framework for PCA services. It utilizes data from the Bureau of Labor Statistics to build a reimbursement rate based on current wage data. It develops a competitive workforce factor to make sure PCA wages are keeping up with similarly situated workers in the private economy. And it recognizes the non-wage costs of providing PCA services like employment taxes, workers' comp, unemployment insurance, paid time off, and training. The second part of the bill addresses program integrity measures. And these include raising provider enrollment standards to ensure new PCA agencies support best practices in accounting, record keeping, and compliance, increasing the frequency with which providers need to demonstrate basic compliance with bond, insurance, and other program participant requirements, enhancing the communication between the DHS Provider Enrollment Division and the Office of the Inspector General to demonstrate continued compliance is investigated while bond and insurance coverage may still exist, and implementing quality standards for all provider agencies that will add value to program participants. The financial impact of the rate framework, as amended with these component values in place, would be approximately $290 million per year in state costs starting in 2023. This bill will positively impact 100,000 Minnesotans who need PCA services, who provide PCA services, and their families too. It will benefit some of the most vulnerable Minnesotans while valuing workers who are offering essential care and deserve a living wage for their efforts, their compassion, and their skill. At this time, Madam Chair, I'll turn to the testifiers for the bill.
Thank you, Representative Lippert. The first testifier is Peng Vang. Welcome to the committee. Please introduce yourself and your affiliation for the record, then proceed with your testimony.
Hi, can you hear me?
We can hear you.
Hi, my name is Peng Vang, and I am the treasurer for the Minnesota First Provider Alliance. So, Madam Chair and committee members, as I stated, my name is Peng Vang, and I run a minority-owned PCA agency, Rainbow Healthcare, located here in St. Paul for the last 15 years. I provide both traditional and PCA choice services to approximately 200 minority PCA recipients in the Twin Cities area. The culturally specific needs of my client are many, including verbal and written language barriers, and require me to provide other services beyond that of a PCA provider agency. 80% of my PCA clients live in Minneapolis and St. Paul. Of the 44,000 people receiving PCA services, 73% live in the 7-county metro area. For the past several years, Provider Alliance has advocated for increased wages for PCAs to establish best practices and higher integrity standards in our industry. The Provider Alliance believes strongly that the PCA program is one of the most cost-effective service delivery models for individuals with disabilities and older Minnesotans, and likely saves the state tens of millions of dollars a year by keeping individuals in their homes and out of higher cost care settings. The PCA program is one of the most diverse long-term service and support program in Minnesota. Of the approximately 44,000 people who access the PCA program, 62% are individuals who are Black, Indigenous, or people of color. The PCA program offers a culturally appropriate service that allows for community members to support each other. Most of the PCA workers are made up of women and people of color. Therefore, the need for diversity in skilled caregiver giving for people with disabilities and older adults can be regarded as an equity issue. People with disabilities and older adults who rely on PCA services to live, work, and participate in their communities are facing a severe shortage of workers to provide these essential services. The difficulty in finding and retaining PCA workers put people who rely on these services at risk of neglect and hospitalization. PCA rates have not kept pace with other comparable home and community-based services. Services that provide similar levels of direct care activities as PCA services are paid at minimum 40% higher in the disability waivers. In the governor's proposal addressing the much needed PCA wage increases under the collective bargaining agreement with the SEIU would be just one step in addressing the workforce shortage. The next step is the adequate reimbursement funding that is needed for the agreement. The CBA will give a 15% increase to wages, bringing the floor wage to $15.25 on July 1st of 2022. The reimbursement rate will only go up 7.22% or to $19.08 per hour. Not only do these rate increases fail to cover the costs of wages, they absolutely make no accommodation for increases in payroll and unemployment taxes or workers' compensation costs that are associated with a wage increase. Nor do they account for the paid time off also included in the contract or holidays that are to be paid at time and a half. The reimbursement rate for PCA is the same in both traditional PCA and choice PCA. PCA agencies will be paying out 95.10% in wages and benefits, leaving just a mere 4.9% for cost of service delivery. As the cost of wages and the cost of delivering services continue to increase, an underfunded rate will not support these higher wages and force many PCA agencies, including BIPOC-owned agencies like mine, to close, leaving only a handful of large nonprofit organizations to meet the needs of all PCA recipients. The unintended consequence of culturally competent agencies closing their doors is the inability of people of color to choose a provider from their own community. The Provider Alliance cautions policymakers that passing significant wage and benefit increases without an adequate increase in the state reimbursement rates could lead to the collapse of the PCA program. Further, the Provider Alliance believes a data-driven, cost-based rate framework should be implemented alongside the CBA to appropriately determine the state's medical assistant reimbursement rates for PCA services. This rate framework has been in development with the Provider Alliance and other advocates, legislators, DHS staff, and representatives of the SEIU since 2018. The PCA rate framework proposal would determine PCA rates using a data-driven method similar to one already in place for other like services that use the disability waiver rate system. PCA reimbursement rates would be determined by collecting data on work experience rates, requirements, pay rates, and administrative costs. Thank you, Representative Lippert, for bringing this bill, and thank you for letting me speak today.
Thank you, Ms. Vang, for testifying and for all the great work you're doing in our communities. We appreciate that. The next testifier is Tim Benjamin. Welcome to the committee. Please state your name and affiliation for the record and then proceed with your testimony.
Hello.
Hi, Mr. Benjamin.
Chair. Good morning, Madam Chair and committee members. My name is Tim Benjamin. I'm a columnist with Access Press, a statewide disability newspaper, where I served as executive director for 20 years. I was diagnosed quadriplegic in 1974 when I was 21 after diving off an unfamiliar dock into a shallow lake just north of the Twin Cities. After a 6-month stay at the U of M, I went home with my parents along with my younger brother and sister, who gave up much of their independence to take care of me without outside help for several years. After those years, I applied for and was fortunate to get 24-hour care a day because of a respiratory difficulty. I'm unable to clear my throat and need help many times a day just to keep breathing. I also have no use of my hands or legs, and so I need assistance with activities of daily living. But because of the PCA help I receive, I have been able to live independently, get an education, marry, and work full-time as a professional job. I also been a longtime advocate for civil rights of people with disabilities. I've tried to pay it forward and help other individuals with disabilities to live a more independent, fulfilling lives. But since the mid-90s, it has been very difficult for agencies who manage my care and for me to hire and retain PCAs. What has changed over the years, making things even more difficult? 3 major factors. The PCA program at DHS has paid very low reimbursement rates for many years. The agencies are unable to afford to pay the wages and benefits comparable with other jobs requiring similar education and training. PCAs are asked to do a broad range of tasks in an environment where theirs are responsible for people's lives and health without substantial training and with little oversight. These have been extremely difficult times for myself and for my friends and for the PCAs. I personally know many agencies that have gone out of business in the past few years because of the low reimbursement rate. It's a never-ending struggle for my agency to find qualified, dependable PCAs who are only paid wages of about $13 per hour to provide my cares. For many hours a week, no one is scheduled to come to help me, which leaves my wife to provide many hours of essential care. But during those hours when I have no staff, I must stay in bed. I'm unable to get up, get dressed, and work, or even take a shower. In other words, by not having PCA support, I am unable to be the productive citizen I've always been proud of being. One answer for someone like me is just to put me in a nursing home. But I remind you that study after study in Minnesota and in Washington, D.C. has found that it's cheaper for a person with needs like mine to get care in the home rather than in a congregate care facility. I urge you to vote in favor of Representative Lippert's bill, House File 663, which will provide actual data on the business costs and provide PCA services, cost of providing PCA services, including comparable jobs in this economy. This data will then be available to set PCA rates so that people like me can continue to live in my home, be productive, and cost less than congregate care. We cannot let the PCA program fail, but it has been dying a slow death for many years. The legislature must do something major to establish a framework based on real data to set the reimbursement rates. You know, one thing that I and so many people with disabilities have heard over the years is, I don't know how you do it. I don't think I could do what you do. You're a real inspiration. Well, all of you here are people with considerable energy, motivation, and dedication to serving others. I know you could do what I've done, but I guarantee you that neither you nor I could do what I have done without the PCA program. Please do not let it die. Thank you for allowing me to speak with you, and thank you for your support of the health and dignity of disabled Minnesotans. And thank you, Representative Lippert.
Thank you, Mr. Benjamin. And thank you for being with us today and explaining your situation and the value of PCAs and the issue we're trying to fix, which is their low wage and the PCA shortage. We appreciate all the advocacy you're doing. Okay, the next testifier is Dolores Flynn. Welcome to the committee. Please state your name and affiliation for the record, then proceed.
Dolores Flynn, and I live in Roseville, Minnesota, and I'm a member of SEIU Healthcare Minnesota. So good morning, Chair Schultz and members of the committee. I provide home care services to my 50-year-old son who needs complex 24-hour-a-day care. He suffered a head injury at age 2. In 2001, after 54 brain surgeries, he had a massive brain hemorrhage that left him a total care patient. He requires assistance in all of his daily living skills. He can do nothing for himself. SEIU home care workers support House File 663 because our PCA rate system should respond to the job market. Thousands of people with disabilities and seniors struggle to find anyone or keep anyone to do this critical work. Working with legislators from both parties, SEIU home care workers have won rate increases with our last 3 contracts. We are working with you this session to fund our recent tentative agreement, which brings the wage floor for PCAs up to $15.25 an hour and makes other important improvements. Just this morning, we had an overwhelming bipartisan vote in the State Government Committee to ratify our contract. I am proud to have served on the bargaining team that negotiated this agreement with the state and to have served on our home care bargaining team for 2 other previous rounds of collective bargaining as well. This bill, House File 663, would provide for rate increases as economic data demonstrates increased demand for home care services. It would help address the critical shortage of home care workers, and it's in crisis. As a parent of an adult who needs care, I worry a lot about worker shortages. We're down 3 now during the COVID crisis. I worry about who will care for my son when I'm not able to. Caregivers so often move on to jobs that provide more stability, like better wages, benefits, long-term career choices. We need to take seriously that not making these investments removes choices for the disabled and the elderly people about where they live, who cares for them, how they get about in the communities. If the care crisis we are now in continues, or even gets worse, which I believe it will, how many more people will struggle to have their needs met? Thousands more will struggle to survive if we continue to lose workers. If my son did not have 24-hour-a-day care provided by SEIU home care workers, he would need to be in some dark, dreary facility, not getting his needs met, and he would probably die within 24 to 48 hours. That's a travesty. Obviously, we want to make sure the details of the bill for home care workers Obviously, we want to make sure the details of the bill work for home care workers and the people we serve. We want to make sure that our union can bargain over how the rate increases get converted into tangible wages and benefits for workers. We want to make sure that the rate increases set a floor for state investments in home care, not a ceiling. We thank the authors and the providers for the language in Article 2, Section 3, Subdivision 9, which seeks to provide that clarity. We have asked MMB and DHS to make sure it does, and we are waiting for their feedback. Since this bill is being laid over, we will continue to work with the state agencies and the bill authors to get that clarity. But it is essential that we get it to make sure workers' hard-won rights to collective bargaining is not unintentionally undermined by this legislation. We also want the transition from one rate system to another to go smoothly. We do not want it to interfere with our contracts, and it should work with the regular cycle of negotiations. We think the current language does, but again, we would welcome confirmation with MMB and DHS. To fully address the needs of seniors and the disabled people in Minnesota, we have a long way to go. We would like to thank Representative Lippert for a good start. Thank you.
Thank you, Ms. Flynn. The last testifier is John Dam. Please state your name and affiliation for the record and proceed with your testimony.
Thank you. My name is John Dam. I'm the CEO and president of Acra Home Care. Good morning, Chair Schultz and committee members. Thank you for the opportunity to testify this morning. As the largest provider of home care services in Minnesota, we are here today to testify in support of House File 663 and for providing a living wage for PCAs. Personal care attendants are essential not only to Minnesotans with disabilities and older adults, but also to Minnesota's healthcare system. As you know, the home care industry helps children and adults with disabilities live in their own homes while reducing overall healthcare costs by preventing costlier out-of-home placements in congregate care settings. Without a strong workforce, we could lose these benefits for both the people we serve and the state's healthcare system. PCAs are critical to supporting older adults and Minnesotans with disabilities, and they do this work while receiving a wage that is less than you can earn per hour at the local Target and McDonald's. While Minnesotans' population ages and the need for caregivers increases, it is becoming increasingly challenging for Acra to attract workers to enter this profession and work for this low wage. Ensuring an adequate workforce is one of the most significant business issues we face as we aim to help more Minnesotans. Because the healthcare coverage our clients receive is through Minnesota's Medicaid program, the rate the state will pay for services is capped by the state legislature, and these rates are barely enough to cover the cost of care. So, to increase PCA wages, it is crucial to also increase reimbursement rates. Our industry needs this PCA wage increase to remain competitive with other businesses. Thank you for your time. We greatly appreciate the governor and the legislature's support in investing in this critical program that helps tens of thousands of Minnesotans. Thank you.
Thank you, Mr. Dom. Let's see, it looks like we have another amendment. Representative Noor, would you like to offer your A3 amendment?
Yes, Madam Chair, I just wanted to discuss my amendment.
Please proceed with are you moving the A3 amendment, Representative Noor?
Yes, Madam Chair.
Okay, Representative Noor moves the A3 amendment. Please provide us information on the A3.
Thank you, Madam Chair and members. I just wanted to thank Representative Lippert for this bill. We understand the struggles for many people who are struggling with their daily living activities. When you do have a PCA, it helps a lot. And quite frankly, this work that is before us looks into the methods of calculations. It also looks into how we can use the market to determine the PCA rates. Madam Chair and members, we know that the cost of living is really significant. Over the past few years, PCA rates have not gone up. In fact, the cost and expenses have gone up. I can give you a quick example. As Minneapolis moves into $15 minimum wage, there will be significant impact on this type of work. We're struggling to find workers at this time. Ms. Vang discussed clearly how this is going to have an equity-based inequities when it comes to providing services to BIPOC. Ms. Flynn talked about the care crisis that we're facing. And quite frankly, we do have a huge work to do. So what my amendment does is it looks into what is the current need based on the income that someone should be able to make in order to provide different types of care. We've heard about the traditional PCA and PCA choice. They're all great methods of doing. And I'm glad to hear that the department is moving to CFSS by fall this year, if I'm correct. That will be a big move that we will be able to provide a service that is more broad-based, making sure that there's an equal playing field and to ensure that we apply the rating. Madam Chair, I just wanted to make sure that people understand when you are earning less than a family living wage, you'll be looking for other jobs. And this is a crisis we don't want to create. This is an issue that we're all facing. I want the department, I want the SEIU to also look into what is the appropriate amount for us to have on a temporary basis while we're looking into the long-term basis that we have the bill before us. This just increases a temporary process whereby we are able to quantify what will it cost to provide care? How do we provide that support? How do we provide benefits? We know that many folks don't even have regular benefits. 401k, if you're talking about long-term, if you're talking about healthcare, we're looking into other people who are receiving assistance because the income is so low that people will apply for public assistance. We have to be able to adjust our system to meet the needs of today. And that's what I'm proposing, Madam Chair. I will not be moving to get this amendment for approval today, but I want people to understand we've got a lot of work to do. And that's what we should be able to do because that's what people sent us to do and provide the services for those who need the most. So thank you, Madam Chair.
So Representative Noor, are you withdrawing your amendment, the A3 amendment?
Yes, Madam Chair, I'm withdrawing my amendment.
Okay, but my understanding is the A3 would increase the rates, the rate amount in the framework temporarily until Representative Lippert's language would go into effect. But you're withdrawing that amendment, so we will not take action on it. Thank you.
Yes, Madam Chair.
Thank you for the discussion. Members, I'm going to open it up for questions. I'm going to limit questions to one per member and then we can circle back and members have more questions just to keep us on track. Any questions from members for the bill author or the testifiers? I'm not seeing any questions from members. Representative Noor?
Thank you, Madam Chair. I just had a quick question in the bill. I know there's the section for the integrity whereby we're requiring the employees to notify the department if they have left working with the PCA agency. Just wanted to know what is the rationale for the employees to notify the department when the contract is with the PCA agencies? Are they not required to notify the department when somebody departs rather than the employee taking that responsibility?
Mrs. Grom or someone else from DHS want to help answer that? Ms. Grom, thank you.
Madam Chair, members, actually, I'm going to defer to Natasha Mers to answer that question.
Okay, Assistant Commissioner Mers. You're muted, sorry. Maybe you're not muted, but we're not hearing you.
Can you hear me now, Madam Chair?
We can, thank you, proceed. Please state your name for the record.
Madam Chair, members of the committee, for the record, my name is Natasha Mers, and I am the Director of the Disability Services Division at the Department of Human Services. Madam Chair and Representative Noor, to your question, the reason why individual providers are asked to notify the department when they lead employment is related to program integrity. Individual PCA providers are enrolled, so they are enrolled as individual people and affiliated with a PCA agency. So part of the program integrity measures that the department is obligated to track and understand is ensuring that that any individual PCA doesn't work over the current monthly allowable threshold, and that the department is, and also to make sure that an individual PCA isn't double billing, and if they are, that the department has a way to track that through claims and billing process with that individual identifier for that individual personal care assistance provider. So those are some of the more details about the program integrity functions that make that notification required and important.
Thank you, Director Mers. I'm going to go to our next question, Representative Albright.
Thank you, Madam Chair. Madam Chair, I have a question, and it really reverts back to the A3 amendment. And I'm a little bit in a quandary, curious why, if the intention is to provide better rates prior to the rate reform bill being enacted, why wouldn't we want to provide for a better or a temporary increase for these folks? I'm curious as to, I didn't quite understand what Representative Noor stated, but having said that, I would like a follow-up based upon your interpretation of why that would not be applicable at this time.
Representative Albright, I believe your question is directed to Representative Noor.
Yes.
But he offered the amendment and withdrew it. Representative Noor, can you help address his question, please?
Thank you, Madam Chair. Representative Albright, the intent was to make sure that we do have analysis that needs to be done. Right now, we don't have that fiscal note that will show how much it's going to cost. And this bill is being laid over. So at least we have this conversation to figure out how much the appropriate cost that we have to increase, because we do have that obligation to ensure that people get the weight that they deserve. So that's one of the reasons that I had to pull the amendment. But this is a conversation we will have to have in this committee to figure out what is the appropriate reimbursement rate at this given time before the bill before us becomes effective.
Thank you, Representative Noor. Representative Albright.
Yeah, but Madam Chair, just as a question, so on the bill in its total, I'm sure Representative Lippert is waiting for the fiscal note on the bill as it would stand prior to amendments be adopted. Wouldn't there be virtue in adding the A3 to understand the full implication of what the fiscal note would look like for the bill itself?
Representative Lippert.
Thank you, Madam Chair and Representative Albright. So we have pretty solid understanding of what the rate framework with current components will cost, which is why I mentioned that in my remarks. I think there's a variety of conversations happening related to Representative Noor's amendment and getting those numbers in a firm, getting those numbers firmed up. So it just needs a little bit more time. And so that's my understanding of the positioning of the amendments today.
Yeah, Representative Albright, I'll just add that I think Representative Noor developed the rates in his amendment and we would like to see more input from DHS on what those rates would be to be able to provide higher wages. And if we put that amendment on, I believe it may hinder the ability to get figure out the correct rate on an accurate fiscal note.
So, Madam Chair, my only
Go ahead,
question
Representative Albright.
Thank you. It seems like we're, chasing our own tail on this one. I'm still curious about the rationale, but I wanted to go back to Representative Noor's, or even possibly, I'm sorry, it might have been Representative Lippert that said, and just to confirm that his numbers, as he said, that pretty firm around this, but he said that the current fiscal note is in the range of like 290 million.
Representative Lippert.
Thank you, Madam Chair. Representative Albright, yes, that's correct. That's the information I received. Some are from the department, or perhaps Mr. Berg might have more to share on that.
I don't believe we have a fiscal note yet, Representative Albright.
No, that's fine, Madam Chair. I'm just trying to firm up what Representative Lippert already kind of surmised in the bill.
Representative Albright, I'm gonna move on, but when we do have the fiscal note, and if this does make an omnibus, we can have a fuller discussion then. Representative Keel.
Thank you, Madam Chair. I guess I'll go to a statement instead of a question. Representative Albright pretty much pointed it out, but we have these conversations over and over and over again, and we try to fix it with finances, and it doesn't work. And I think we spend a lot of time talking about the importance of caring for disabilities and their challenges. And they themselves are very active. I've had a lot of conversations, as has other members. I have one in my district that is a quadriplegic that's very active in how this works. But I'm really concerned about the fact that we don't really talk about where we're going with it, rather than the importance of it. The testifiers, and I don't think there's anybody on the committee that thinks this isn't important. I think the bigger problem is that we've got to come to some kind of understanding. It is a costly program. There's no doubt about it. And certainly we want to pay people that take 24 hours to take care of somebody. And it's not easy work at all. I think it's good educational work for people going into the medical system. In fact, I think it's super important. I almost wish we could mandate everybody that's going to be a doctor to work in a home and take care of somebody. It would open up eyes to doctors who say things to you at the clinic or whatever. And God bless them, they're all very good. But I just oh, so how is this going to happen? So anyway, I know we got to go move along. So thank you very much.
Thank you, Representative Keel. Thank you for that comment. I do think we all care, and we have been talking about this. And it's a priority for me to get the rate framework done, just like it was a priority to get the rate framework accomplished with DWRS, and we got it done. And now we need to do it for the Pca Rate Framework. And I hope you'll join me in figuring out how we can raise revenue to increase wages of the PCAs. Representative Liebling.
Yeah, thank you, Madam Chair. Well, that was really well said. I was going to say something similar. I'm thrilled with this bill because I think it actually moves us forward, and really appreciate that Representative Lippert has dug into this and is taking it on, and to the department, of course, because this is really, on the macro level, it's on the micro level. There's just so many things. But my question was kind of brought up by the discussion with Ms. Merce around the program integrity piece. And so my question is there any requirement of the agency, in the case of where this is through an agency, to notify the client when a PCA is no longer going to be working there? Because there have been some incidents in the past, probably not with PCAs, but with other healthcare workers, where a healthcare worker is no longer working, say they get fired, say they, in the worst case, they are, caught with illegal substances or something happens, they're fired by an agency, and then the client isn't told, and there have been, an incident I can think of where the person showed up and continued serving the client for illicit reasons after that occurred. So is that built into this at all, or is that something we need to deal with completely separately?
Director Mers?
Thank you, Madam Chair and members of the committee. To address that question, I can give some high-level comments, and then I think we would like the opportunity to go back and follow up with the committee to make sure that we're providing the accurate information. So the short answer is that who's required to notify the person using services when an individual provider has been terminated or quit for whatever reason does depend on whether that person is using the PCA choice program or traditional PCA services. So traditional PCA services, the agency itself is the employer of the individual worker. And if that individual worker were to be separated from employment for whatever reason, it is the agency's obligation to notify the person using services and then help them select a different provider or see if they had a different provider that they might want to bring on and affiliate. For a person that's using the PCA choice program, they are in a joint employment relationship with their with the PCA agency, and they also have obligations as a joint employer of those workers as well. And so in a case where a person is in the PCA choice program and their individual worker is fired, quit, again, whatever the circumstance, it is in part up to the individual person to make a decision about hiring and firing for that individual worker. And then, and they generally hold responsibility for that. And they would be responsible for working with the PCA choice provider to find alternative staff to meet needs and make sure that they have those backups available.
Director Mers. Thank you for Director Mers. Chair Liebling.
No, that's, yeah, thanks for that explanation. And yeah, I know there's another bill floating around kind of connected to this issue too. And yeah, I would appreciate a little more conversation offline, but that's helpful. Thank you very much.
Okay, I'm not seeing any more questions. So House File 663 will be late, as amended, will be laid over for possible inclusion. Thank you, members.